Have you ever wondered if the very medication you trust every single day could be quietly changing the way your brain works? Every year, millions of older adults begin noticing small memory slips. At first, it is forgetting a familiar name, misplacing the car keys, or walking into a room and suddenly forgetting why they went there. Most people assume it is simply part of getting older. But what if, in many cases, the real cause is hiding inside the medicine cabinet? After years of studying how the human body protects and repairs itself, one lesson has become impossible to ignore. The brain is remarkably resilient, but it is also incredibly sensitive to the chemicals we introduce into it every day. Today, I want to walk you through 9 common medications that research has linked to memory problems and cognitive decline in older adults. Some of these medicines require a prescription. Others can be purchased in almost any pharmacy without speaking to a doctor. Yet many people never realize they may be affecting the brain until the symptoms become impossible to ignore. Before we begin, remember something very important. Never stop taking a prescribed medication on your own. Every treatment has benefits as well as risks, and any changes should always be made together with your physician or pharmacist. The goal of this conversation is not to create fear. It is to give you the knowledge needed to ask better questions and protect your brain for years to come. Let's begin with number 9, a medication that is found in millions of homes and is often considered completely harmless simply because it has been sold over the counter for decades. Many people reach for it whenever allergy season arrives. Others use it when they cannot sleep. Some even take it during a common cold because it helps them rest through the night. It seems inexpensive, familiar, and safe. Unfortunately, appearances can be misleading. The medication belongs to a family known as anticholinergic drugs. That may sound like a complicated medical term, but the idea is surprisingly simple. Your brain depends on a chemical messenger called acetylcholine. Think of it as one of the body's communication networks. It helps nerve cells exchange information, create new memories, maintain attention, and support learning throughout life. When medications block this messenger, the brain suddenly has a harder time processing information. In younger adults, the effects may only cause temporary drowsiness, but the situation changes dramatically as we age. The aging brain naturally produces less acetylcholine. Because of that, even a medication that seems mild can have a much greater impact on memory in someone who is 65, 70, or 80 years old. One of the first areas affected is the hippocampus. This small structure deep inside the brain plays a central role in converting today's experiences into tomorrow's memories. Every conversation you remember, every face you recognize, every new skill you learn, depends heavily on this remarkable region working properly. When acetylcholine is repeatedly blocked over months or years, researchers have found that memory performance may gradually decline. The change is often so slow that families rarely notice it at first. Instead, they explain it away as normal aging. Perhaps someone repeats a question twice. Maybe they forget an appointment. They misplace their glasses more often. Or they lose track of a conversation halfway through. None of these events seem alarming on their own, but together they may represent a pattern that deserves attention. Several recent studies have strengthened this concern. Researchers following thousands of older adults discovered that individuals using strong anticholinergic medications regularly were significantly more likely to develop cognitive impairment and dementia compared with those who avoided these medicines whenever possible. While research continues to evolve, the message has remained surprisingly consistent. Long-term exposure appears far more concerning than occasional use. That is why I encourage every older adult to read medication labels carefully. Many nighttime cold medicines, many sleep aids, and many allergy products contain the same active ingredients under completely different brand names. Without realizing it, someone may be taking 2 or even 3 medications that work in nearly identical ways. The total effect on the brain quietly grows larger with every dose. Fortunately, safer alternatives often exist. Newer allergy medications are designed to treat symptoms while entering the brain far less aggressively. For many patients, they provide similar relief without placing the same burden on memory and attention. Again, this is never a decision to make alone. Discuss it with your healthcare provider and ask whether another option would better match your long-term health goals. Now let's move to number 8. This next medication helps millions of people every single day by controlling acid reflux and heartburn. For someone living with constant burning in the chest or throat, the relief can feel life-changing. Many patients remain on these medicines for years because the symptoms quickly return whenever they stop taking them. Yet very few people realize that stomach acid performs an essential job beyond digestion. It helps the body absorb several nutrients that the brain cannot function without. Vitamin B12 is one of the most important. This vitamin supports healthy nerve cells and plays a major role in maintaining memory and mental clarity. When stomach acid remains suppressed for a long period, B12 absorption may gradually decline. Magnesium levels may also decrease. Both nutrients are critical for normal communication between brain cells. Over time, deficiencies may begin producing symptoms that resemble the earliest stages of dementia. People describe increasing forgetfulness, mental fatigue, difficulty concentrating, or feeling as though their thinking has become slower than it once was. Instead of asking whether nutrition has changed, many simply assume their brain is aging faster than expected. Large population studies have reported an association between prolonged use of certain acid-suppressing medications and a higher likelihood of developing cognitive decline later in life. Scientists continue investigating exactly why this relationship exists. Nutrient deficiencies appear to be one explanation. Other research suggests these medications may also influence proteins involved in Alzheimer's disease, although much more investigation is still needed before firm conclusions can be reached. The encouraging news is that many individuals do not require these medications forever. Some can gradually reduce their dosage under medical supervision. Others may benefit from alternative treatments, dietary improvements, weight management, or different classes of medication that place less stress on the body's nutritional balance. The important lesson is simple. Every medication should be reviewed from time to time. What made sense 5 years ago may no longer be the best choice today. And, sometimes, protecting your brain begins with asking one simple question during your next doctor's appointment. Do I still need this medication? Or is there a safer long-term option? As we continue down the list, the next group of medications often surprises people because they are prescribed to improve quality of life, not to treat life-threatening disease. Yet, for many older adults, the effects on the brain deserve just as much attention as the benefits they provide. Understanding these medications does not mean you should fear them. It means you should know the right questions to ask and recognize when a safer alternative may exist. Number 7 includes medications commonly prescribed for an overactive bladder. Many older adults experience sudden urges to urinate, frequent trips to the bathroom, or accidents that interfere with daily life. These symptoms can affect confidence, sleep, travel, and even social activities. It is completely understandable why someone would welcome a medication that offers relief. The challenge is that several of these medicines work by blocking the same chemical messenger we discussed earlier, acetylcholine. As you now know, acetylcholine is not only involved in bladder function, it also plays a vital role inside the brain. It supports attention, it strengthens communication between nerve cells, and it helps convert everyday experiences into lasting memories. When these medications reduce acetylcholine activity throughout the body, the bladder may become calmer. Unfortunately, the brain may also become less efficient. Some older adults gradually notice that they struggle to remember recent conversations. They begin forgetting appointments more often. Simple tasks require greater concentration. Words seem harder to find during ordinary conversations. Because these changes usually develop slowly, they are frequently mistaken for normal aging. Several large studies have found that long-term use of strong anticholinergic bladder medications is associated with a noticeably higher risk of cognitive decline in older adults. Researchers believe that repeated interference with acetylcholine may gradually reduce the brain's ability to process and store new information. The encouraging news is that treatment options continue to improve. Newer bladder medications work through different biological pathways and appear much less likely to interfere with memory. If you currently take medication for bladder control and have noticed increasing brain fog or forgetfulness, bring those concerns to your physician. Very often, there may be another approach that protects both your independence and your cognitive health. Now let's move to number 6, a category that often creates confusion because these medications save lives every single day. They are cholesterol-lowering medications commonly known as statins. Millions of adults rely on them to reduce the risk of heart attacks and strokes. For many people, they remain one of the most important medications they will ever take. That is why it is essential to approach this topic with balance rather than fear. The purpose here is not to suggest that statins are harmful for everyone. Far from it. Many patients receive tremendous cardiovascular protection from these medications. However, the brain also depends on cholesterol. In fact, nearly 60% of the brain is made up of fat, and cholesterol serves as one of the building blocks used to maintain healthy nerve cells and the protective coating surrounding them. This coating allows electrical signals to travel rapidly and accurately throughout the nervous system. When cholesterol levels become very low, some researchers believe that certain individuals may experience subtle cognitive changes. Not everyone develops these symptoms. Many never notice any problems at all, but others describe episodes of forgetfulness that seem unusual for them. A familiar name suddenly disappears. A conversation becomes difficult to follow. Or they temporarily lose their sense of direction while driving a route they have traveled for years. Recent scientific studies have suggested that a small percentage of older adults taking specific statins for extended periods may experience mild cognitive changes. Researchers continue studying exactly why this occurs and why it affects some individuals while leaving others completely unaffected. Interestingly, not every statin behaves the same way. Some enter brain tissue more easily than others. Certain medications within this class appear less likely to cross the blood-brain barrier, making them potentially better choices for individuals who experience cognitive side effects. This is why personalized medicine matters. If you have recently started a statin and notice changes in memory or concentration, do not stop taking it on your own. Instead, speak with your healthcare provider. Sometimes adjusting the dosage is enough. Sometimes switching to a different statin solves the problem. And in many cases, the medication is not responsible at all. The key is careful evaluation rather than assumptions. Protecting your heart and protecting your brain should never be viewed as competing goals. With thoughtful medical guidance, both are often possible. Before we continue, I want to pause for just a moment. If you are finding this information helpful, take a second to support the video. When educational content reaches more people, it gives more families the opportunity to ask important questions before problems become permanent. I also enjoy reading your comments. Tell me how many prescription medications you currently take each day. Every story helps shape future discussions and reminds others that they are not alone. Now let's move to number 5. These medications are frequently prescribed for anxiety, panic attacks, and difficulty sleeping. For someone experiencing overwhelming anxiety or nights without rest, they can feel almost miraculous in the beginning. The mind finally becomes quiet. The body relaxes. Sleep returns. For many patients, the improvement feels immediate. Unfortunately, long-term use tells a more complicated story. These medications increase the activity of a calming brain chemical called GABA. That calming effect reduces anxiety, but it also slows many other brain functions at the same time. Learning becomes more difficult. Reaction time decreases. New memories become harder to store. Attention begins to fade. Some people even describe feeling emotionally distant, almost as though they are watching life rather than fully participating in it. Several long-term studies have associated prolonged use of these medications with an increased risk of cognitive decline and Alzheimer's disease, particularly among older adults who continue taking them for months or years. Researchers believe the constant slowing of brain activity may gradually interfere with normal cognitive function. Another challenge makes these medications particularly difficult. The brain quickly becomes accustomed to them. If someone stops suddenly after long-term use, withdrawal symptoms can become severe. Anxiety may return even stronger than before. Sleep may become almost impossible. Some individuals experience shaking, confusion, or even dangerous medical complications. That is why these medications should never be discontinued abruptly. Instead, physicians usually recommend a slow, carefully supervised reduction that allows the brain time to adapt safely. For many people, newer treatments for anxiety and insomnia can provide meaningful improvement without carrying the same long-term cognitive concerns. Behavioral therapy, improved sleep habits, stress management, regular physical activity, and certain newer medications may all become part of a healthier long-term strategy. Remember, the goal is never simply to eliminate symptoms. The goal is to improve overall health while preserving the remarkable organ that allows you to think, remember, learn, and enjoy every moment of life. Now let's continue with another medication that many people never expect to see on a list like this. It has been prescribed for decades, and for countless patients it has provided meaningful relief from several different conditions. That versatility is exactly why it deserves a closer look. Some medications are used for depression. Others help calm chronic nerve pain. Some are prescribed for persistent headaches, and in many cases they are even recommended to improve sleep. When one medicine seems capable of treating so many different problems, it often becomes a long-term companion rather than a short-term treatment. For some people, that is perfectly appropriate. For others, however, regular follow-up becomes extremely important. As we grow older, the brain changes in ways that are both remarkable and delicate. It becomes more dependent on efficient communication between nerve cells. That communication relies on a carefully balanced network of chemical messengers. Whenever a medication repeatedly interferes with those signals, even in small amounts, subtle changes can gradually appear. At first, they may seem insignificant. Perhaps remembering names takes a little longer. Maybe reading becomes more difficult because concentration drifts. You begin walking into a room and briefly forget your purpose. These experiences happen occasionally to everyone. The difference lies in how often they occur and whether they continue becoming more frequent over time. Researchers have spent years studying medications with strong anticholinergic effects because this particular group appears repeatedly in studies involving cognitive decline. Although these medicines remain valuable for certain patients, long-term use should always be reviewed carefully, especially in adults over 65. The encouraging news is that medicine continues to evolve. Today, physicians often have access to newer treatments that can provide similar benefits while placing less stress on memory-related pathways. For chronic nerve pain, newer therapeutic approaches may offer meaningful improvement. For depression, several modern medications appear much gentler on cognitive function in older adults. And for sleep, physicians increasingly recommend addressing the underlying cause rather than depending solely on medication night after night. Sometimes improving sleep habits, treating chronic pain, increasing daytime physical activity, or managing stress more effectively can reduce the need for medications altogether. Every person's situation is different. That is why individualized care remains the cornerstone of good medicine. Now let's move to another medication that surprises many people because it belongs to one of the most commonly prescribed classes of antidepressants. Most people assume that every medication within the same family behaves exactly alike. In reality, that is not always true. Although these medicines often share similar goals, their effects inside the brain can differ in meaningful ways. Certain antidepressants appear relatively gentle on memory. Others may influence important chemical messengers involved in attention and learning. For older adults, even these small differences can become important over years of treatment. Some patients describe feeling mentally slower after several months. Others notice increasing difficulty recalling recent conversations. Reading a book becomes more challenging because concentration fades more quickly. Finding the right word during a conversation suddenly requires extra effort. These symptoms are often subtle. They rarely appear overnight. Instead, they develop gradually, making them easy to attribute to aging itself. Fortunately, physicians now have many antidepressant options available. If someone experiences unwanted cognitive side effects, it does not necessarily mean antidepressant treatment should stop. It may simply mean that another medication would better match that person's biology and overall health. This highlights one of the most important principles in modern medicine. Treatment should never remain on autopilot. Every medication deserves periodic review. Your health at 70 is not the same as your health at 50. Your kidneys change. Your liver changes. Your metabolism changes. Even your brain processes medications differently as the years pass. A prescription that once represented the perfect choice may no longer be the ideal option a decade later. That does not mean the original decision was wrong. It simply means that good healthcare adapts as the body changes. Now we come to another group of medications that deserves thoughtful discussion because they are sometimes prescribed under circumstances many families do not fully understand. These medicines were originally developed to treat serious psychiatric illnesses. For those conditions, they can be life-changing and, in many situations, absolutely necessary. But over the years, physicians have occasionally used them for additional reasons, particularly in older adults experiencing severe agitation, confusion, or behavioral symptoms. These situations are often emotionally difficult for families. Watching someone become restless, frightened, or unable to sleep can be heartbreaking. Caregivers naturally want relief for the person they love. Healthcare professionals share that same goal. However, every decision must carefully balance benefit against potential risk. Some medications in this category can produce profound sedation. Individuals may sleep longer than usual. Their reactions become slower. Conversation becomes less spontaneous. Motivation declines. Family members sometimes notice that their loved one seems physically present but emotionally distant. Researchers continue investigating how prolonged exposure affects cognitive function, particularly among older adults already experiencing memory challenges. Current evidence suggests these medications should be prescribed thoughtfully, monitored closely, and reviewed regularly to ensure they remain truly necessary. Whenever possible, non-medication strategies deserve attention as well. A predictable daily routine, better lighting during the evening, reducing unnecessary noise, treating untreated pain, encouraging gentle physical activity, supporting meaningful social interaction, and improving sleep habits can sometimes reduce distress without increasing medication burden. These approaches require patience. They require teamwork. But in many situations, they can make a meaningful difference. One of the greatest advances in modern medicine has been recognizing that successful treatment is not always about adding another prescription. Sometimes it is about understanding the entire person, their environment, their nutrition, their sleep, their relationships, and the many small factors that influence how the brain functions every single day. As we prepare to discuss the final two entries on this list, an important pattern should already be becoming clear. Rarely does one medication alone explain memory loss. More often, several small influences gradually combine until the brain begins struggling under a burden that nobody recognized was building. And that hidden combination may be one of the most important discoveries you can make to protect your cognitive health in the years ahead. Now we arrive at what may be the most overlooked risk of all. Ironically, it is not a single medication. It is not one prescription, and it is not one diagnosis. It is the combined effect of several medications working together in ways that many people never realize. This is where the conversation becomes especially important for older adults. As we age, it becomes increasingly common to manage more than one health condition. One medication may help control blood pressure, another supports heart health, a third improves sleep, a fourth reduces allergies, a fifth eases bladder symptoms. Each prescription may be completely appropriate when viewed individually. The problem begins when nobody steps back to examine the entire picture. Think of your brain as an orchestra. Every chemical messenger has a specific role. Every signal arrives at exactly the right moment. Every nerve cell depends on precise communication. Now imagine several medications quietly lowering the volume of those signals at the same time. One medicine may reduce alertness just slightly. Another may interfere with memory a little. A third may slow reaction time. Individually, the changes seem almost impossible to notice. Together, however, they can gradually reshape how the brain functions. This is one reason comprehensive medication reviews have become increasingly important in modern medicine. Healthcare providers are no longer looking only at whether each medication works. They are also asking whether the entire combination continues to serve the patient's long-term health. Research over the past decade has consistently shown that medication burden matters. The greater the number of medications affecting memory-related pathways, the greater the possibility that cognitive function may gradually decline. This does not happen to everyone. Many people tolerate multiple medications remarkably well. Others become much more sensitive, particularly as kidney function, liver function, and metabolism naturally change with age. The challenge is that these changes rarely appear overnight. They develop quietly. Perhaps someone begins forgetting birthdays. Then appointments become harder to remember. Simple conversations require greater concentration. Reading becomes more tiring. Following complex instructions feels unusually difficult. Because each change seems small, families often assume they are simply witnessing normal aging. Sometimes they are. Sometimes they are witnessing something that can actually be improved. One of the most encouraging discoveries in geriatric medicine is that medication-related cognitive problems may, in certain individuals, improve after unnecessary medications are carefully reduced under professional supervision. The brain possesses an extraordinary ability to adapt. Scientists refer to this as neuroplasticity. Even later in life, nerve cells continue forming new connections. Healthy pathways continue strengthening. The brain continues responding to positive changes. That means protecting cognitive health is never a lost cause. Small improvements made today may still produce meaningful benefits months from now. This is why regular medication reviews should become part of every older adult's healthcare routine. Bring every prescription to your appointment. Bring every over-the-counter medication. Bring every vitamin. Bring every herbal supplement. Even products that seem completely harmless deserve discussion, because they may interact with prescription medications in unexpected ways. Many people are surprised to discover that they are taking two medicines with nearly identical effects. Others learn they are still using prescriptions that were originally intended for only a few weeks, but somehow remained part of their daily routine for years. Medicine changes. Guidelines improve. New research becomes available. What represented the best treatment several years ago may no longer be the best option today. That is not a failure. It is simply how good healthcare continues to evolve. Another important step involves simplifying medication schedules whenever possible. Taking fewer medications at the appropriate dose often reduces the chance of unwanted interactions. It may also improve adherence because complicated schedules become difficult to follow consistently. Your physician or pharmacist can often identify opportunities to simplify treatment while maintaining the same level of medical protection. Lifestyle also deserves equal attention. No medication can fully replace the powerful influence of healthy daily habits. Regular physical activity increases blood flow to the brain. Nutritious foods provide essential vitamins, healthy fats, antioxidants, and minerals needed for normal nerve function. Quality sleep allows the brain to clear metabolic waste and strengthen newly formed memories. Meaningful social interaction stimulates multiple brain networks simultaneously. Learning new skills creates fresh neural connections throughout life. Even something as simple as taking a daily walk while having a conversation with a friend combines physical exercise, emotional well-being, language processing, balance, hearing, and memory into one remarkably effective brain workout. Never underestimate the cumulative effect of these small habits. Individually, they may seem modest. Together, they become one of the strongest foundations for healthy aging. At the same time, pay attention to your body. Notice changes. If you begin a new medication and suddenly experience unusual confusion, persistent brain fog, difficulty concentrating, or memory changes that seem different from your normal aging, do not ignore those signals. Do not panic either. Instead, write down exactly what you notice. Record when the symptoms began. Document any recent medication changes. Then bring that information to your healthcare provider. Specific observations often provide valuable clues that help physicians determine whether medication, illness, nutritional deficiency, poor sleep, or another condition may be contributing to the problem. Remember, the goal is not perfection. The goal is awareness. The more informed you become, the better equipped you are to work alongside your healthcare team in making thoughtful decisions that protect both your body and your brain. As we move into the final part of this discussion, we will bring everything together. More importantly, we will focus on practical steps you can begin taking immediately to reduce unnecessary risk, support long-term brain health, and help preserve the clarity, independence, and quality of life that every person hopes to enjoy as the years go by. Now that we've explored the medications most commonly associated with memory problems, I want to leave you with something even more important than a list of drug names. I want to leave you with hope. Because despite everything we have discussed today, your brain is far more adaptable than many people realize. It is not a machine that simply wears out. It is a living organ. Every single day it is repairing damaged cells, creating new connections, strengthening useful pathways, and responding to the choices you make. That is one of the most remarkable discoveries modern neuroscience has given us. Healthy aging is not determined by one decision. It is shaped by thousands of small decisions repeated over time. The medications you take, the foods you eat, the quality of your sleep, your physical activity, your relationships, your stress levels, and the conversations you have with your healthcare providers all work together to influence the future of your brain. If there is one message I hope you remember after watching this video, it is this. Never assume that memory loss is simply an unavoidable part of getting older. Yes, aging changes the brain. That is completely normal. But not every episode of forgetfulness should automatically be blamed on age. Sometimes the explanation is surprisingly simple. A medication may need adjustment. A vitamin deficiency may need correction. Poor sleep may be affecting concentration. Dehydration may be reducing mental clarity. Depression or anxiety may be interfering with attention. Even untreated hearing loss can make the brain work much harder to understand conversations, creating the appearance of memory problems when the real issue lies elsewhere. The encouraging news is that many of these factors can be improved. That is why early attention matters. The sooner changes are recognized, the sooner they can be investigated, and in many situations, the sooner meaningful improvement becomes possible. One of the most valuable appointments you can schedule this year may not involve a new test or a new prescription. It may simply be a comprehensive medication review. Sit down with your physician or pharmacist. Bring every prescription medication you currently take. And bring every over-the-counter product. Bring your vitamins. Bring your herbal supplements. Nothing is too small to mention. Many people are surprised to discover duplicate medications, unnecessary prescriptions, or combinations that may be increasing side effects without providing additional benefit. These reviews are not about removing medications simply to reduce the number of pills. They are about making sure every medication still serves a clear purpose. Medicine should improve quality of life. It should never quietly diminish it without anyone asking why. I also encourage you to think beyond medication. Protecting your brain is a daily commitment. Move your body regularly. Even a 30-minute walk most days of the week increases circulation to the brain and supports healthy blood vessels. Challenge your mind. Read books. Learn new skills. Practice a musical instrument. Solve puzzles. Have meaningful conversations. The brain thrives when it is asked to keep learning. Feed it well. A diet rich in colorful vegetables, fresh fruits, healthy fats, nuts, seeds, beans, and fish provides nutrients that support both the heart and the brain. Increasing evidence continues to show that what protects the cardiovascular system often protects cognitive function as well. Do not overlook sleep. During deep sleep, the brain performs some of its most important housekeeping activities. It strengthens memories, removes waste products, and restores the energy needed for another day of thinking and learning. Poor sleep night after night places unnecessary stress on every system of the body. Managing stress deserves equal attention. Long-term stress affects hormones that influence memory, mood, and concentration. Simple practices like deep breathing, mindfulness, spending time outdoors, and maintaining strong social connections can have meaningful effects on emotional and cognitive health. And perhaps most importantly, stay connected. Isolation is one of the greatest hidden threats to healthy aging. Conversations stimulate the brain. Laughter reduces stress. Friendships encourage movement, curiosity, and purpose. Human connection remains one of the most powerful forms of medicine we have. Remember that every person is unique. A medication that causes side effects in one individual may work beautifully for another. That is why personalized medical care is so important. Never compare your treatment directly with someone else's. Instead, focus on understanding your own health, asking thoughtful questions, and making decisions together with qualified healthcare professionals who know your medical history. Knowledge does not replace medical advice. It strengthens it. When patients understand why they take a medication, what benefits to expect, what side effects to watch for, and when to seek medical attention, they become active partners in protecting their own health. That partnership often leads to better outcomes than either patient or physician could achieve alone. Before we finish, I want to ask you something. Take a moment today and think about the medications you use regularly. Have you noticed changes in memory, difficulty concentrating, or increasing mental fatigue that seem to appear gradually? If so, do not ignore those observations. Write them down. Discuss them during your next appointment. Sometimes one simple conversation can change the direction of your health. It can lead to a medication adjustment, a nutritional evaluation, better sleep strategies, or another solution that helps restore confidence and mental clarity. Your brain has carried every memory, every lesson, every loved one, and every experience that has shaped your life. It deserves the same level of attention and care that you give to your heart, your bones, and every other part of your body. Thank you for spending these moments with me today. I hope this discussion has given you practical knowledge, greater confidence, and a renewed appreciation for how many aspects of brain health remain within your control. If you found this information valuable, share it with someone you love. A single conversation could help another family ask an important question before a small problem becomes a much larger one. And if you'd like to continue learning about protecting your health as you age, make sure you don't miss our next discussion. We'll explore the subtle changes your body often reveals long before serious illness develops, including several physical signs that many people overlook during their daily routine. Sometimes the body begins sending quiet signals months or even years before symptoms become obvious. Learning to recognize those signals may allow you to act earlier, make better decisions, and protect your long-term health. Until next time, continue asking questions, continue learning, continue caring for your body, and most importantly, continue protecting the remarkable brain that makes every moment of life possible.